Hi there, I'm Dr. R. Deuk, CEO and founder of the Deuk Spine Institute and inventor of the Deuk Laser Disc Repair. I'm here with the gentleman who just had the Deuk Laser Disc Repair, L34, L45, L5S1. And tell us about your back pain that you had before surgery. Do you still have it?
I don't have any back pain that
It's
I
cured.
had prior to surgery.
Would you say it's cured?
I would say it's cured.
Good. And the leg pain you had before surgery?
It's gone.
Cured.
Cured.
And you just went to the bathroom. Everything working good?
Everything's working well.
All right. You came out of surgery 45 minutes ago. Where are you going now?
To get lunch.
Going to get lunch and go home. So we're not in a hospital.
No?
We're not at a hospital operating room.
No.
Everything is outpatient.
Yes.
And you're going home less than an hour after your surgery.
That's awesome.
Yeah. So we got everything done with one little incision on the left side. I was able to fix all 3 discs. And he and I talked before surgery. We knew we had to do L45, L5S1 because those discs were right where his pain was. But the L34 we weren't sure about. And I told him I'd test it, and if it was causing his pain, his typical pain, then we'd fix it. And that's exactly what happened. We tested it. It was a 9 out of 10 pain. And it was his typical pain, so we did the repair. When I actually put the needle into the L34, I could feel it going easily, which means there's a tear there.
Okay.
So we knew there was a tear from the needle going in. I tested it with the dye, and it was 9 out of 10 pain. The other 2 discs were 10 out of 10 and 10 out of 10.
Good.
So we got everything done we were supposed to. Your spine is a little twisted with some scoliosis, but that's not going to be a problem for you. We fixed the source of your back pain and your leg pain.
Awesome.
Anything? You're welcome. Anything you want to say to everybody? You're the last surgery of 2020.
Thank you all, and thank you especially, and y'all are awesome.
Thank you. All right. Thank you very much. Get out of here and go home. Okay?